A cross-section of residents say they are aware of the tuberculosis disease in terms of how it is spread and how to prevent it. Tuberculosis is a dangerous disease because it is airborne.
Tuberculosis can easily be contracted, and if not treated early, it can kill. Coughing in public when you haven't started receiving treatment can easily transmit the disease.
Tuberculosis, TB, is an infectious disease usually caused by Mycobacterium tuberculosis bacteria. According to a report by the World Health Organization (WHO), in 2012, 122 people out of 100,000 people worldwide were diagnosed with tuberculosis. In the same year, at least 86 people out of 100,000 people in Rwanda were infected with the disease. The number dropped to 57 out of 100,000 people by 2020. Some of the nurses who follow up on tuberculosis patients at different health centers say that they are doing their best to treat and monitor tuberculosis patients despite the challenges they still face. We give medicine to patients regularly as we monitor their health. Patients are required to take medicine in front of a doctor. TB has reduced significantly, but we are still worried about people who provide wrong addresses, which makes it hard to follow up on them.
There are some patients we give medicine and never come back, and sometimes you cannot follow them up because they deliberately gave the wrong addresses. When a TB patient comes, we give them medicine and then assign them to community health workers so as to reduce unnecessary journeys to and from the hospital.
The DHS survey by the National Institute of Statistics of Rwanda indicates that 68% of Rwandans are knowledgeable about TB. The standing goal is to reduce the incidence of tuberculosis by 80% by 2030. According to Patrick Migambi, the Division Manager for Tuberculosis and Other Respiratory Diseases Department at the Rwanda Biomedical Center RBC, there are many things that need to be done to achieve this goal, including teaching and treatment. We have to put more effort into educating people about the symptoms of tuberculosis, and we have to put more effort in treating TB patients. We can say that in Rwanda, we are lucky that TB treatment is free of charge. Therefore, all Rwandans are required to undergo a voluntary TB test. Figures from RBC indicate that last year, 5,435 people were diagnosed with tuberculosis. Of these, 83.5% had pulmonary tuberculosis and 16.5% had bone tuberculosis. Patients with severe cases of tuberculosis accounted for 28%. Every year, 1.3% of patients who start TB treatment do not complete it due to the fact that they do not remember the dates they started taking medications. Sam Kalisa, Rwanda Television News.